be our November meeting, but we moved to this December date to wait a little time after the election in hopes that we would get our feet on the ground and see how the elections turned out and have some of the new possibly elected folks at our board meeting. So it's December 8th, but would normally be our November meeting. Thank you. I'd like you to stand with me as we pledge allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. I'd like to ask our director, Mr. Don Duffy, to make some introductions at his discretion.
Thank you, Mr. Chairman. I would like to introduce Sandy Riggs. Sandy Riggs is our new HR specialist here at Panhandle Health District. You may have remembered Michelle Kenny, who served in that role for many years. Sandy has a lot of work experience. She comes from the Kroc Center. She's many years there as their HR director. And in the very short time she has been here, she has added value to our company. And very, very happy to have her with us.
Okay. Bruce, you're Bruce, and you are a newly elected county commissioner for Kootenai County, is that correct?
Yes, I start January 9th.
All right, thank you for coming, and hopefully you'll work time in your schedule to come and see us again.
Absolutely. Today I just want to stick around for a few minutes and just see how things.
Absolutely, yes. And if it helps to get you here, if we have food, let me tell you that we have food between 12 and 12:30 every meeting.
Well, it was pretty good, so it won't hurt to continue.
Yeah. All right. All right. We always have our public comment session, and so I will open the meeting now for a public comment session where you are allowed 3 minutes to speak, after which there will be no comment or questions. It's your opportunity to speak, can be heard, and then we will move on with our meeting. Is there someone who would like to utilize this time for public comment? Second call, public comment. Third call. And hearing no taker, we will move on with our agenda. The consent agenda is the next item on your agenda. And you'll notice that there are a number of items. There's the minutes from September 22. Any comment from those minutes, corrections? They're lengthy. Division reports, always thankful for the division reports. And then there are contracts. There are 6 contracts. Do you have any questions or comments on any of the contracts?
Mr. Chairman,
Yes, go ahead.
just for clarification, the contract HC 324-100, I do not see a dollar amount on that. I just see.
Thank you. Don is ready to answer your question.
Thank you.
Yes, the value of that contract, it's a 2-year, almost a 2-year contract, and it's $3,558,283.
Thank you.
Okay, I would entertain a motion then that we accept the consent agenda of the items I just mentioned. Is there a motion?
Mr. Chairman, I would make a motion that we accept the consent agenda as here presented with the correction to the one contract.
Thank you. A second?
Second.
Thank you. I hear a second. Any other discussion? We've had the opportunity already to discuss, so all in favor of approving the consent agenda indicate by saying aye.
Aye.
And opposed, no. And we have approved the consent agenda. In your packet, you saw a proposed schedule for the calendar year 2023. This follows the same pattern that we have been using over the last few years. If you've looked at it, I think it consists of about 9 or 10 meetings, subject to change if need be, like this very meeting today. Any questions or comments about the meeting schedule for 2023? Hearing none, I would like to hear a motion then that we approve this meeting schedule as a guide for the year 2023.
Mr. Chairman, I would move that we approve the Panhandle Health District meeting calendar as here presented.
Second. And I hear a second. Thank you. All in favor then of approving this meeting schedule for the next year, which is already around the corner? All in favor, say aye.
Aye.
And opposed, no. Okay. Didn't hear very many ayes, but didn't hear any noes either. So we have approved the schedule, meeting schedule for 2023. We have invited our legal counsel, Mark Lyons, to be here and remind us again and discuss with us the Board of Health responsibilities and protocol. Doesn't hurt for us to be reminded what our role is as board members. So I will turn the floor over to our attorney, Mark. You may speak.
Thank you, Mr. Chairman. I think it's a good idea to at least once a year to review board responsibilities and some of the issues that individual board members come across over the year. I know you've had a long day, you've had other meetings, and I'll try to be fairly brief, but I'm going to try and cover. There we go. Does that work better? Thank you. I'll try to cover a number of things here. Board responsibilities. This Board of Health is an oversight board. It is a governing board for the Panhandle Health District. But what does that really mean? Different boards have different responsibilities and different ways of approaching them. For example, some boards are part-time, uncompensated, kind of like this board. And your responsibility is oversight. You have a fully employed executive director who's by statute, whose responsibilities are to run this district. You have staff with our full-time employees with various expertise and various other responsibilities. This board is an appointed board. Some boards are elected boards. But just to contrast these things, I went through one time and looked at responsibilities of different types of boards. Most boards, or many boards, have no operational authority. Some boards have a lot of operational authority. For example, county commissioners, they have operational responsibilities. Sewer and water district boards have a lot of operational responsibility, and there are different reasons why. Commissioners are essentially full-time employees and they run the counties. Sewer and water boards usually don't have any staff, so whoever gets on the sewer and water board has to do most of the work. So they have that responsibility. Other boards are oversight. So what does that mean? That means that you, as a board, consider the initiatives, the policies, programs that are brought before you. You discuss them, consider them, and make a decision on going forward. And typically you would follow the recommendations of your chief executive, who is charged to bring these things to you. So you do that as a board. And what that means is you vote as a board and you debate it. You may vote in favor of it. You may vote against it. But once it is done, even if it passes and you didn't support it by vote, you as a board member have a responsibility to the organization to nevertheless support that decision. It's already been made. You had your discussion, so you support it. Once in a while, we hear about situations where board members go out and then they try to actively undermine the decision. That is a symptom of a dysfunctional board. So I would caution everybody, and I say this frequently, not to do that, to support what happened, even if you didn't vote for the ultimate decision. Individual trustees, and this is true for almost all oversight boards, true of all oversight boards, don't have any authority. Individual trustees have no more authority than any member of the public. You only have authority when you act as a board. So what is your authority here for the health district? Well, it's pretty broad, actually. It's also quite narrow. It's listed in the statute, and you probably have looked at that at some time or another. For example, you have, as a board, the authority and responsibility to do all things required for the public health. Now, that's extremely broad. It's extremely vague, but it's quite broad. You also explicitly have the power and the authority to locate where the office is supposed to be. Okay, pretty narrow. But the point is, you have certain listed things that you are responsible. The real question comes down to, how do you exercise that? You exercise it because you have a director that you have chosen who is by statute authorized essentially to run this organization. The director brings these things to you, you review them, you discuss them, and then you make a decision if a decision as a board is necessary. I think it's important just from a governance standpoint, and I say this I've been fortunate to have been legal counsel for a number of public organizations, school districts, most notably the college. And I try to be consistent in saying this. The purpose of those boards is to ensure that the mission of the organization is achieved, not day-to-day control. It's not to carry out the interests of individual board members, but to look for the interest of the organization and promote that. You are the oversight board. You are not the agenda. For this organization, the agenda is put together by the executive director, the chief executive, usually consultation with staff. They know what the problems are facing the district. They have to deal with them every day, not once a month, every day. And so they will bring these things to you for consideration. Typically they coordinate with the board chair on the agenda, but those are the things that you consider, things that are brought to you as a board. And that's how it should be. If you have your own individual things that you would like to see happen, you might bring them up, but it may not be appropriate for the agenda. For example, I have a lot of things I would like to see, but I shouldn't be able to put them on the agenda. I would expect Don to tell me no. It's not my role. My role is to give legal counsel to this organization. Your role is to consider the initiatives put in front of you and make decisions when asked to do so. So that's kind of my spiel on governance. Other things that I think are important, which I think some of are just self-evident. What does a well-functioning board do? Well-functioning board, the members contribute by discussing with each other in a positive way, even if they disagree. This board has always done that. We've had, over the years, some very contentious topics that have come before this board, but the discussions have always been civil and respectful, and decisions are made, and everybody respects the decision, even if they didn't support it. So that has been the history of this board. So you remain policy-oriented rather than operationally focused. Other things that I think are just important to review are the open meeting laws and the public record laws, because they will affect you. You will note them when you get a subject that comes before the board that the public is very interested in, or the newspapers are interested in. So comply with open meeting law here. I think many of you know that. Many of you have been commissioners or on other boards, public boards. So if you have an issue on it, bring it up. It'll get addressed before the meeting so that it's done properly. All your decisions take place in an open meeting. That's required. You don't get together amongst yourself. At least you don't get a quorum. And a quorum for this board is 4 members. You don't get together, decide things in advance, and then show up to the meeting. You've had your public meetings is a legal one. Your get-together is an illegal one. Public records law. This is the one that I think trips up a lot of board members. It's simply because they don't think about it. We all email things, we all text things, and we text things that or email things that we probably wouldn't want to be on the front page of the paper. But when you are doing anything related to the health district and you're on the Board of Health, keep in mind everything that you do could be a public record. We haven't had too many lawsuits trying to extract text materials, but those have come up in the past, and I suspect that they're coming up in the future for public boards. So snarky sort of things that might be funny in text or in context, a month later is not going to look funny to other people that are looking at it. Emails back and forth. My rule is always never write and send an email that you wouldn't be happy having it plastered on the front page of the paper or spread across social media, because depending on what it is, that's exactly what could happen. So those are just reminders. If you have questions about anything in specific, feel free to ask it. And if you think of something later and you just want to call me, I don't charge the health district for that. It's just something you got a question about, public records issue or open meeting issue. I've dealt with those for 20 plus years. So if you ask me, I'll just give you my thoughts. I'll call it pro bono. So I wanted to just do this very quick refresher. I don't want to take more of your time, but it's important to remember what you are. You're an oversight board. That's the 30,000, proverbial 30,000 foot review. You take recommendations from your chief executive and the administration that works with these issues every day, and you make decisions as a board, not as individuals. And that's the main takeaway here. So that's all I was going to say. So if anybody has any questions, I'm open. Yes, sir.
So a couple of questions.
Sure.
As it relates to oversight. So does a board member have the capacity to examine, for instance, with the treasurer, the details of the financials?
Okay. So the short answer is yes, but there's a longer answer to it. I usually remind board members that when they have questions that would go to staff, go through the executive director, you go through the director, and the director will I would expect would gatekeep that. So as a board member, you would need to, as part of the decision, because you review the budgets, and so sometimes you have to make decisions on that. So yes, you can have that. But I would just caution every board member not to give homework. If you're on the board and you want to see the finances, they should be public, they should be out, and you'll probably get to do that. But if you start asking for specialized reports, remember, these people have a full-time job and they're working all the time. If you start asking for specialized reports or special information or your own projects to be undertaken, frankly, if you were asking it through me, I would push back. But yes, I think you can get that information. I think your director would see that individual board members can have the access to the finances. You should have that.
Thank you for that answer. Let me follow up though.
Sure.
When I say the financials, what we get is a 30,000 foot view. It's all summarized, sanitized, it looks great. But let's say there's a board member who effectively wants to do an audit and is willing to do the audit herself. That is to say, not instruct a staff member to do it, but to get into the raw data. Is that permissible?
I would think that there would be pushback on that you wouldn't do that. The reason why is because that board person is not an auditor for this organization. The organization has its own audit. This organization gets audited every year through the state, and those audits reports are public. The financials are public, and so to come in, for example, an individual board member, as I mentioned before, has the same status as a just any ordinary citizen. Would we let somebody come off the street and say, I want to delve into the details of your records, go through in your office? The answer is no. You wouldn't do that. And I wouldn't expect a board member would push for that. Frankly, that it's disruptive to the work that's ongoing. The finances for public organizations are open and available. And yes, you do get the overview, and you can ask questions during budget time about things. And I would expect that if you have questions, you would do that. But to go through and do an audit of the organization, I'd say no.
Well, then could a board member request an audit?
Well,
Or is that not even permissible?
well, it's
By
not
saying
that.
official auditor
Well,
or third party?
if a board member were to bring that up, and that issue is put to the board decides.
Okay, then that leads me to another question. Remember, I had two questions. So in the overview capacity, is that a passive role or a potentially active role? And you just touched upon it. Does a board member have the capacity to request an action?
Well, officially, no, but I would, what board members typically do is they go to the executive director and the chairman and say, this is interesting to me, or I think this is something that you should consider. And I think you have to respect their decision. So,
what I'm hearing you say, everyone correct me if my hearing is wrong, I am losing my hearing. You're saying for the most part, your role as a board member is passive.
correct.
You come in, there's an agenda, most of it is consent, you nod your head, you have a motion, a second. And that the capacity to be actively involved is de minimis, and in as much as it is even exercised at all, you go to the executive director and the chairman, and if they say not interested, then that's the end of the conversation.
I think the short answer is generally that's true. That's true. You ask questions. You ask questions when things come up as a board member, and you discuss it as a board member. But ultimately, you can't, as a board member, initiate things any more than on your own with the administration, any more than any person in the public would. If the board makes a decision that they're going to do this, or this initiative comes forward, yes, you consider that, discuss it, and then the board makes a decision. Individual board members do not. Does that answer your question?
Crystal clear.
Okay.
I'm duly put in my place.
Oh, I'm not trying to put you in your place.
Wish you-
Well, it's not my intention. This is the same advice that I give to other public boards. That it's look at your role. Board members have lanes that they operate in, and I think it's important to respect those lanes and respect that the organization has full-time people that are doing things. And if the board as a group wants to go somewhere on some initiative, then that's the board's decision.
You said as a group, but earlier you said executive director and chairman, that's not the group. That's okay.
Okay. I'm not sure I was inconsistent, but okay. Maybe I don't understand your question. The board.
Would be you put forth a proposition, and there is a discussion of the full. In contrast to the Roman model, which would be you have chiefs, and you do only what the chiefs want.
Yeah, here as oversight, you as a board, oversight, review the initiatives that come before you. That is generally your role.
Passive.
Correct.
Got it.
Okay. Anything?
Yes.
Mark, I have a question. So quarterly, I'm meeting with county commissioners. I go to all 5 counties and visit with them quarterly. It's mostly an update of what's happening in the health district. If they had something that they wanted to make some change within the health district, they observe whatever that might be. Am I understanding you saying that that once they've given that idea to me, that I have the choice of putting that on the agenda?
Yeah.
Or as I look at that, if I felt that's a valid concern, I could have the right to put that on the agenda as the executive director. Is that
Yes.
what I understand?
Yes. I think you can do that.
Thank you.
But to follow up on Don's question, if the commissioners of a given county request some item, can Don contravene that and say, no, I don't want that on there?
Well, yes, he could,
Okay.
but the executive director works with all of the commissioners and the counties, and this is a cooperative relationship. So, yes, it would be within his authority to say no, but I would assume that there's a cooperative relationship there, and that's going to be addressed.
Does a board member have the right to speak to the commissioners?
that's a dicey issue. Of course, you can speak to anyone you want. Here's one of the problems of communication board members. When you're on a board and you are communicating with people and you are a member of the Board of Health, the problem is people will take your communications sometimes as the position or a position of the Board of Health. It is confusing, and I recommend that you don't. That if you want communication, particularly communication to maybe another organization, a peer organization, or a county commissioners, that communication happens at a level that either the director level or whatever the board might decide. But no, if you're going to go discuss policy.
What if the communication with the commissioners is one of seeking advice?
Seeking advice of.
In other words, we
commissioners.
represent the commissioners
Right.
on this board.
Right.
So when we have a question regarding some policy that we are considering and we want their input, then it would be appropriate
I
for
would
us to
expect
go
you.
to the commissioners, either all together or separately, and say, hey, what are your thoughts on this?
Oh, yeah, that is true. I mean, you are appointed by individual counties, and so you are the representative of the county. So, yeah, I think
Be
that's
appropriate.
appropriate, Glenn. Yeah.
So it's okay to ask the advice of the commissioners that appointed you.
Yeah, I think the commissioners that have appointed you are probably going to tell you what it is they're interested in anyway. So you don't come here, come here with no knowledge at all. You come here with your background, your experience, and when you come from a particular jurisdiction, which some boards don't have that necessarily, but you do. You're appointed by individual counties for the most part. Yeah, I would expect that you would come with some input from them. But it's different to have the county's discussions or the county's position than to have a board member going around to counties and arguing for an individual agenda item. So if it's the county's agenda, I think that's appropriate. Let's have that discussion, and that'll come up the way it should through the organization.
So to clarify your last statement, were you to go to the commissioners that appointed you and ask their advice, does the topic have to be specific to that county, or can it be a more general topic?
Oh, I don't think the rules are that rigid.
So you're saying there's no restriction to the content of the advice?
Well, I can't think of any right now, so there are no hard and fast rules on
So-
this.
Just to be sure, a board member should not, and I'm totally on board with this, go around to all 5 counties caucusing anything.
Right.
That's a job. But it is permissible for a given board member to have a relationship with the commissioners that appointed that person.
I would expect that to be the case.
Okay. And there are no restrictions to the content of those conversations.
Well, I don't know. I can't think of any, but I would think that as a board member, you would get the county's input and have the county's whatever concerns, if any, the county may have, and you come armed with that.
So if I have a meeting with the Bonner County Commissioners in February, can I invite you to come to the meeting? So that I can put me in trouble? I'm a very transparent person.
Okay. Well, it's up to the county commissioners. Are they going to speak with you? Have they contacted you? Okay, so I would expect that they're.
And we can have a free conversation. Oh, and by the way, on this public-private thing, do you want that meeting to be behind closed doors?
Well, are you,
Non-public?
Wait.
We can have that happen.
well, it depends on what it is. But if, are we talking about you're going to be there as a representative of the Board of Health there, talking and presenting and discussing things as a representative of the Board of Health? Because
I'm
that,
not representing the Board of Health. I'm representing myself fundamentally.
okay,
And I'm not representing a specific policy of the board or position of the board. I'm mostly representing myself, seeking counsel.
But is the intent to use your position as a board member to achieve something?
Well, yeah, I want to achieve something, because ostensibly the commissioners have, you've already said, if I come to these two gentlemen with an agenda and they go, not interested, well, then can I go to my commissioners and say, well, there's this agenda that I think is important. What I'm asking them to do is back me up and maybe make a phone call to these gentlemen and say, you know, really, this is a pretty important topic.
well, no hard.
Reasonable, is that?
Could that happen? Sure, I suppose it could happen. Would that be responsible for a board member to go and have, and have some personal agenda item forerun through the commission and then ask the commissioners to do that? That's I'm not particularly comfortable with that practice. I recognize that sometimes things like that happen.
Now, you have used the term personal agenda several times in the
Sure.
last 20 minutes.
Sure.
But if the agenda fundamentally is public health, it's not personal at all.
Well, most of the agenda items arise organically up through the organization. So if you want to have something that is public health related, I think you bring it to the director and have it risen that way. That's the recommended course of action.
And if the director and chairman say no, there's no appeals process.
That's true.
Is there a way I can get a copy of the bylaws of this organization?
There are bylaws of this
I know,
organization.
but can you send them to me?
Well, somebody can, sure. Board members should have copies of the bylaws.
Okay, thank you.
Anything else?
Mr. Chairman, the bylaws are in your packet today.
Here?
Yes, sir.
Oh, good. You read my mind.
Are there other comments, questions to what Mr. Lyon presenting at this time? If not, we will thank you, Mark, for your help today, and appreciate your help anytime we call upon you, which is quite often. Thank you very much.
Okay, Mr. Chairman, if I may, I'll be excused.
You may.
Thank you.
And with that, we will move on with our agenda. And so, Glenn, do you have something from the executive council as our trustee today?
Well, thank you, Mr. Chairman. I think as other board members are aware, this year, the Panhandle Health District will be hosting the annual meeting for all the other boards of health and their representatives. They'll be coming here in June. And we had a discussion of that during our executive council meeting on Monday, December 5th. And Unfortunately, there were only 3 of us trustees present from Health District 2 and Health District 7, and the other ones were not there. They were represented by their directors for their individual districts for all of them except District 6. As I recall, Maggie wasn't there as well as Bon Rasmussen. So anyway, it was a fairly simple agenda. We just reviewed the minutes of our last meeting in September. I'm trying to hold a quarterly meeting at least, unless there's going to be legislative issues or something that the trustees and the other boards of health need to be involved with. And at this time, there is not. Our primary interest in discussion item number 4 on our agenda was the food fees. And we discussed the fact that the Idaho Association of Counties had not selected our food fees issue as one of the legislative 5 issues that they were going to really work on and push with the legislators. So we talked a little bit about that, and we determined that we need to try to find a sponsor that's a member of the legislators that could represent our food fees issue and lobby for us and that kind of thing. So we discussed a little bit, and at the time we didn't have the list of who was on what committees. We now know that we have a member of District 1 that is on a very important committee. And so I will be approaching him, and I think Don will be approaching him as well to try to get him to help sponsor or at least generate some discussion among the legislators, at least prepping the ground, hopefully, for next year if we can't get it in front of them this year. Because the food fees issue, as Eric has explained, is a big thing. It's a big expense. I think our county commissioners would all support us in trying to get the Idaho code changed so that the fees that are charged for the licensing and the inspections would be more appropriate. So that was one of the issues that we will continue to pursue. We're not going to let it drop. Other than that, we had no other real business, and I'm going to try to hold another meeting probably, I would think, towards the end of January, the first part of February, before the next Idaho Association of Counties meetings. That's when most of the county commissioners can get together, and we may try to go down there and be face-to-face, because I'm not real happy with the go-to meeting or the Zoom meetings. I prefer to be face-to-face. That, Mr. Chairman, is my report on what's happening in the world of the trustees.
Okay. Which right now isn't a whole lot.
There wasn't a whole lot of excitement to be there. Obviously, they all have a lot of things to do as county commissioners, and they're busy, but we do want to generate more excitement about next year's meeting. Mr. Bradshaw, how you doing, Steve?
Thank you.
Good.
Thank you. Okay, if that concludes your
That concludes
portion,
my report.
Christine, it just looks like you're ready to go. We'll hear from you now. Thank you. And I would remind you that at some point in Christine's presentation today, she will be asking for a vote on and she will explain that to us. So don't let me forget that we have a vote coming up.
So we'll look at the budget to actual first. We're reporting on the 4 months ended October 31st. Our month end just closed for November. That's why we're not reporting on November financials. There wasn't enough time to have everything prepared and scrubbed by today. So for October ending, let's look at our total revenue. We had total revenue of $6,038,000, and our total expenditures were $4,161,000, leaving us with an excess of $1,876,000. Let's look at some of the variances. In our fees, we have fees, contracts, and miscellaneous income. We have a favorable variance of $1,304,000, and the majority of that is made up in the grants. That variance is due to $1.3 million received in opioid funding. So that's the bulk of the variance right there in our revenues. Another portion of it, $168,000, would be money that we received for smoking cessation. When the budget was prepared early last year, last spring, we weren't aware of that funding source. Our variance related to county of $399,000, that's a timing issue, a billing issue. We are under budget in personnel costs, also under budget in operating expenditures, under budget in capital expenditures. We are over budget in trustee benefit payments, and this is primarily related to the HRSA grant, where a opportunity came up where they could support and provide a program deliverable in the community, and we were not aware of that, again, during budget development. So that leaves us with an excess of $1,991,000. So if we look at our overall actual excess of $1,876,000, adjust for our accounts receivable, we had an increase, $738,000. That, and adjust it to our beginning cash balance of $3,935,000. That brings us back to our ending cash balance of $5,073,000. Are there any questions on the budget to actual before we move to the cash history? No questions. We'll look first at the cash history related to October. Here's our $5,073,000 that we just saw on the budget to actual. It leaves us with 4.88 months in reserves, but after adjusting for board committed funds of $518,000 and program restricted funds of $1,914,000, at the end of October, that leaves us with 2.54 months in reserves. Now, we're going to move on to my request to move funds from the general fund into board committed funds. And we did have enough information to look at the cash balances as of the end of November. So at the end of November, we have $5,620,000 in cash available. That gives us 5.56 months in reserves. But after adjusting for board committed funds and program restricted funds, that gives us 3.21 months in reserves. Now remember, let's revisit board committed funds. Board committed funds are funds that the board commits to things like building maintenance, IT, things that we know we'll need in the future. And that's what we'll be discussing momentarily. Program restricted funds are funds that we receive from outside sources, like the opioid funding is a perfect example, where we've received that money, but it's targeted for a specific use. So we track that and we keep that separate. That cannot be part of our operating funds. So that's what that $1,861,000 represents. Again, at the end of November, we had 3.21 months in reserves. Ideally, I'm comfortable with 3.25 to 3.5. So I'm good with making this recommendation here. I am proposing to the board, and it's a conservative request, that we move $150,000 from our general funds into board committed funds. And I'm proposing that we put $75,000 into building maintenance, that we move the interest that's been accruing in the board committed fund to IT, and we put $75,000 into the 27th pay period, which will occur in fiscal year 28. Now, my objective is this building, we've been in this building about 17 years now. And in the St. Mary's building, we've been in that building about 14 years. We've been fortunate not to have significant maintenance costs in either building. And typically when we do our budgets, we will budget projects and include that in each fiscal year's budget. But as our buildings get older, we could potentially be faced with some very large expenses. As an example, I'll give two examples. If you go throughout this building, you'll notice significant wear in the carpet and where it's pulling up. So we need to be thinking about budgeting or committing funds for carpet replacement in this building. Another thing that we need to be thinking about is our HVAC systems. One of the other districts had to completely replace their HVAC system, which cost them $425,000. Eric reached out to DivCo that maintains our system. And the lifespan of an HVAC system is 15 years. However, a well-maintained system could last 20 to 25 years. And they can continue to maintain our system, assuming that it doesn't become obsolete and parts continue to be available to us. As an example, our system is made up of 4 main components. So 2 of the 4 components, if one of those 2 components had to be replaced, that cost is $240,000. The other two components, their individual cost is $100,000. So going to my objective, I would like to see us slowly build up our building maintenance to cover a cost in the event that we have a catastrophic failure or need a replacement for something significant. Our 27th pay period in fiscal year 28, I estimated that at that point in time, at a 4% increase, our payroll should be approximately $430,000. And I conservatively estimated an increase in health insurance. In fact, I suspect it was maybe too conservative. And that one's a difficult one to project because the state may have reserves to where they can keep the premium down. So In summary, he's not my summary. In summary, I'm requesting that we move $150,000 from the general fund into board committed funds. And we did not do this at the end of fiscal year 22. I'm proposing that we do this now. And if we have excess funds at the end of fiscal year 23, we will potentially revisit moving some more funds over.
But Christine, that your last sentence is not included in the current motion, is that correct?
That is correct.
Okay.
That is correct. Today, I am only requesting $150,000 be moved from the general fund to board committed funds.
Okay, do I hear a motion to that effect?
Mr. Chairman, for purpose of discussion, I'd make a motion that we approve the moving of the $150,000 has been discussed.
Okay, and if there's a second, then we'll open it up for further discussion.
I would second.
And
I have a question. It seems like we have a maintenance review team that regularly looks at all of our buildings that and we're developing that on a regular basis. Could you kind of review that, Don?
Yes, Mr. Chairman, Eric Kettner heads up that building committee, and they do review these items. It is in need of update, however, and Christine and I talked about that recently to make sure that we are 5 years out on potential building improvement.
do you have any additional comment, Eric?
Mr. Chairman.
You don't have to. I'm not putting you on the spot.
Yes, so Mr. Chairman, I do have a question for Christina. So the two categories would be building maintenance, for $75,000, and information technology at $47,377. Is that correct?
Correct.
Okay.
And
And I was wondering, in the non-board committed funds, I know we've got maintenance funds, et cetera. I was just curious as to what this would bring the total.
for board committed funds,
Are these funds accessible only in case of emergency, or how are these funds accessible that were the board committed funds?
okay, the board committed funds, and after today's action, that total would be board committed funds of $669,000. Each month it will increase slightly for the interest. But at any time, those funds can be moved back to general funds based on board approval.
Okay. And these board committed funds are in interest-bearing accounts.
Correct.
Okay.
Correct. And this is the interest that has
that are
been
accumulating.
accumulating. Correct.
Okay, thank you.
One of the things, Christine, that probably isn't feasible to even talk about, but one of the engineering flukes of this building was when they put the HVAC equipment right above this meeting room, and so we hear the roar of that equipment all the time, especially in the summertime when the refrigeration is working. But I suppose it would be cost prohibitive to move that equipment to some other location to get rid of that roar that we constantly hear in this room.
Sounds like true.
If there are no further questions, Mr. Chairman, this concludes my report.
Well, except we haven't voted yet.
Oh,
Motion.
excuse me. I'm getting anxious over here.
All right. Any other questions or discussion on the motion? If not, then we'll call for the question. All in favor of this transfer that Christine has proposed, all in favor indicate by saying aye.
Aye.
And opposed, no. And you have your marching orders.
Thank you, Mr. Chairman.
And if this is the end of your report, thank you indeed. And then we will simply move on to our director. And he has several items that he would like to bring to us at this time. Don, you have the floor.
Thank you, Mr. Chairman. Just some update on some things here. I wanted to let the board know about what's happening with our opioid settlement fund update. We now calculate that the health district will be receiving over $400,000 a year for the next 16 years as it relates to this opioid settlement funds. Some of this is money that we've received, we have been allocated by a couple of counties and a couple of cities because some of them are also receiving this money. And that may not be the end. There's still other settlements in works. And so we are working under Kim's direction. We are actively working to have a plan in place of how those funds will be used to try to deal with this opioid use disorder situation that we're facing. And we are meeting regularly to discuss that. So I'm looking forward to, in the next month or two, to present to the board how those funds are going to be used. We certainly feel responsible for the funds we receive, but particularly the funds that are being allocated to us from, let's see, the city of Post Falls now, which we just found out a couple of days ago, the city of Coeur d'Alene, Bonner County, and Shoshone County, and also the city of Hayden, which wasn't much, but we do feel responsible for those funds. And we'll be reporting back to all of those entities how we're using the funds that they have allocated to us. So just wanted to, I'll continue to keep you updated on that. We are venturing into a new process with our primary care clinics. We've added an MD to our clinics. We've always had 3 excellent nurse practitioners and continue to have them. They perform a marvelous service for us. But we have contracted out with Cupid Health to have Dr. Anna Chase join us in our clinic here in Hayden. And this is really part of what we had from our community health assessment about the lack of access. And so Dr. Anna Chase and Dr. McClanders helped us with this. She started last Thursday, I think, is that correct? She will be here 2 days a month to start. Also with Jenna Dow, our Clinical Services Division Administrator, she acquired a grant, which you approved today, of $35,000. It's a rural healthcare grant to help to defray the costs for Dr. Chase. So we're excited with that addition. We'll keep you posted on how that's going. Also, just of interest, we had a car stolen here from the health district. Now, this is just a curious experience that I just thought for fun I would share with all of you today. So, we actually have a video of it here. Thank you, Kate. So we're going to show you just what happened. This is no real knowledge, but you might find it interesting. So at 8:15 in the morning, when all of our staff were arriving here, we had this van coming.
The video?
Sorry.
I know we'll give Robert 38 seconds to fix this. This meeting's gonna be long here. Where was the store?
Robert. Oh, guys, Board of Health.
Okay, let's try this. So this van, this is at 8:15 in the morning. These are company or employee vehicles coming. This vehicle came around from behind the building and slowly made its way past all of our vehicles. And what they were doing is they had the key fob to the building. And they drove behind all of these until they found the lights. So they located, I'll get to why they had the key fob here in a And so they came through, they're gone, they left, they did not take the deal. It's that red vehicle,
They're
right? You see
identified.
it blinking? You see
Oh.
that? Here's the van who now located the vehicle they were going to abscond with. And we also have it on video. So this van finds the car, it then leaves the parking lot without taking the red Subaru. I just love telling the story. And so he comes along and he leaves the premises. Are we going to see him from the back parking lot too, Kate?
Yes.
Can we see that? Okay, so you will see that this van, if you look in the subdivision behind those trees, this van is going to reappear behind those
Over there.
trees.
And
And
access.
it's at that point,
There it is.
yeah, the individual, there they are, there's the car right there. And you will see the individual leave the van and, did he exit from a moving vehicle? I don't know.
He's coming.
It's coming.
Okay. We'll keep you in suspense here for just a second. I think I can see him getting out. And I just find this so remarkable. This is during a normal business day that all of this is happening.
They got their modus operandi down pat here.
Yeah, they really do.
I think the fog.
There you go.
Oh, there he is.
This happens to be the newest vehicle in the fleet too. I might just throw that out.
So that was the 24th of October.
Now you will notice we did not have good enough video to see the license plate of that van, which I'll get to here in just a moment. So he comes over, just nonchalantly hops in the car, and off he will go with our red Subaru. So when our staff, we noticed that the vehicle was not there, contacted the Kootenai County Sheriff's Department, who came over and we explained the situation. We really thought, well, it's gone. We had already contacted risk management that we will never see this car again. And lo and behold, when that van got down to the local corner, pictures were taken of that van. Kootenai County Sheriff
Got the
posted
plates.
those pictures, there it goes, posted those pictures on their website. And the day it posted, that van was from a plumbing company in Post Falls who had done work for Panhandle about a year prior. And when the person saw that, they called the sheriff's office and said, hey, that plumbing company van was at my home. Do I have something to worry about? Which then we were able to get, or the sheriff was able to get the information. The sheriff went to the plumbing company, walked in, explained to the owner, who was livid, used more language than even I know how to use. And because he was upset that one of his vans had happened, well, lo and behold, the driver of that van was at the store at the time. The sheriff questioned him. Come to find out, the man who left and took the car was his brother-in-law, who took the car to, I'm missing a bunch of details, took the car to Spokane. He's homeless, was living in the vehicle, but all said and done, we were able to get that vehicle back with the key fob and everything else. So we're currently waiting to see if the county is going to prosecute for this. I certainly hope they do. And we actually have tallied about $1,000 in cost because we wanted to get it cleaned out and appropriately ready. And I will be working with Mark to see if we can reach out to the plumbing company to cover that. But when they were here a year ago, one of them saw our key rack with all of our extra keys and just grabbed it and left. We've now put that, it was in a secure place, it's now in a more secure place that hopefully won't happen again. So I just wanted to share that. I felt that was interesting. Eric and his team were behind relocating that vehicle and bringing it back to the health district. So it's back home again. The last thing that I wanted to talk about was our and our board member Glenn talked about our IAD meeting in the spring. We are currently negotiating a contract with the Hampton Inn for that to be located. It will be from June 8th through 10th, and we're getting all those pieces together. We've got a team together to make sure that that functions appropriately. I will admit to you, as I shared with Glenn before, I'm a little concerned of attendance for that meeting. I don't want to be in a position where we get these blocker rooms and they're not used. That would be an expense that I would prefer not to have. So we're kind of working through that right now. Again, for 2 years, those have all been virtual. And so we're working on that. But unless there's any questions, Mr. Chairman, that's the end of my report.
Okay, any comments or questions? Yes.
Can I clarify one thing? Dr. Chase is a resident or not a resident?
No, she is not a resident, and if I could defer, no, she's not, and
The only reason I ask is because it says bring Dr. Chase, a medical resident, into the clinic every other week, so I just wanted to clarify.
The reason I might say that, Dr. Chase is did a fellowship at Wisconsin and is one of our faculty, one of our full-time faculty. He's been here for 3 years. I might say that because we're gonna bring residents out to see patients with her as well.
Okay.
Thank you for your role in that.
Yeah, we wanna be here. We've been trying to do this for about 8 years.
Okay, any other questions? Thank you for that question. Any other questions or comments? Items for next agenda. Our next meeting will be January 27th. And to the board members, I will say prior to January 27th, you will be receiving evaluation forms. And we will have an executive session at the end of our January 27 meeting where we will review director performance and then I'll report the results to our director. That will be at the end of our meeting on January 27th, Mr. Chairman. That would be the 26th. That would be the 26th. All right, I like the 26th a lot better than 27th. Any other business to come before this meeting at this time? Thank you for a busy day. Oh, yes, I'm
Yes,
sorry.
you'll have permission to ask a question.
Sure, that's what I've asked.
Okay, well, it was timid. So at 10:54 a.m. Eastern Standard Time this morning, the FDA extended the emergency use authorization of the COVID vaccines to human beings in this country down to the age of 6 months. Will PhD support and promote the vaccination of our citizenry in accordance with federal guidelines down to 6-month-olds?
Okay, I have heard the question, for which I do not have an answer. Any other questions or comments before we close the meeting? If not, then this meeting is adjourned.
The question that I hear is, are we gonna be administering that? Is that what you're saying? I'm not clear on the question. I'm not clear.
Well, it is now government,
FDA,
HHS is going to suggest that 6-month-olds get the COVID vaccine.
Right.
Is Panhandle Health going to follow suit and follow those guidelines? It's a simple question.
I would stand corrected by all team, but we received guidance from CDC and then through our Idaho team. And so I would say my understanding would be that just because FDA approved does not mean that CDC has agreed Am I correct in this? And our work is related to connection to
Keep in mind-
CBC and item.
The meeting is adjourned. This is off record.
Would you like
No,
me
yeah.
to? I can tell you where we have been with the COVID vaccine thus far.